call again?
The hospital?
Which hospital are you?
Mercy in Cedar Rapids?
Cedar Rapids, Iowa?
Yes.
Is there any way I could speak with the house supervisor?
Are you a nurse here?
No, I have an administrative complaint. It's the weekend. Administration is not there, and I'd like to speak with the house supervisor. I used to be a nurse there, and yes, I am a registered nurse. Is there an issue with me speaking with the house supervisor for 30 seconds?
Well, there's a Met call going on right now, so she's not going to be available for the next probably 30 minutes.
Okay, so is there a patient advocate available at this time or no?
No, they are closed for the weekend.
So if I wanted to speak with administration, I would have to wait an hour or so and try to get called back and speak with the house supervisor?
If you want to speak to the nurse supervisor, she won't be in for about 30 minutes. Administration is closed over the weekend. I'm sorry, ma'am. I do have to hang up because we have that medical emergency.
So that chick is the operator. And when a Met call comes, you call the Met call, and everybody goes. The operator don't do anything except cancel the Met call or call a code blue. But that's exactly how, again, I gotta hang up, you call, and she just canceled the call. That was unprofessional, it was rude, and it was not correct. And there's a rapid response. You call rapid response, and they announce it over, and you heard the guy in the background talking with her. But the same way that they treat the black workers, the same way that they treat the black patients, is the same way she just treated me. This is how, again, and I'm wondering, with the police killing black people all in the open, shooting them in the eye, I watched this video, and the video said, more murders is happening in the hospital than it is on the police force. But the hospitals have fake signs up that talk about you can contact that complaints at jco.gov.com. You can't contact JCO in an email. Everything is misleading the public, from the murders in the hospitals to the murders in the police force. Everything is doing nothing except misleading the public. My sister went to the hospital, supposed to have radiation on her breast. They radiated her thyroid. My cousin, they radiated her thyroid. And if you look at the number, and then Cedar Rapids they have the whole section blocked off. So if you have a breast mastectomy, it's one surgeon. They talk about props and profit and coercion. If you have a breast mastectomy, it's one surgeon, one reconstructive doctor to cut your breast off. And he tell you he only deal with one other partner that deals with anesthesiology. And he has one other partner, and then they fraudulently bill you. It's only 3 people in the Cedar Rapids area to remove the breast cancer. And I'm thinking, if they making it this big of a deal, are these women really having breast cancer? Or are they just out here with a profit? Should they take the breast tissue and send it out to another lab to make sure it's cancerous? Because if you got one physician in this huge area that's cutting off both breasts, then he send you to one radiation person or chemotherapy person that does the radiation or chemotherapy, and then he sends you to one breast reconstruction person. I was sitting right next door. Why is it a closed loop? I only work with these people. The hospital's talking about how if you can't give more than $20 to this person or $20 to that organization, and you can't accept money. How can you not accept money, and how can you not accept any of these things when these doctors are actually have the market cornered to where them and their buddies is getting 20, 30, 40, 100, thousands and thousands, millions of dollars with this breast cancer situation? And then my sister had bills, and a doctor was billing her, and she'd never seen the doctor before. It's Medicare and insurance fraudulent billing at Mercy. It's for black people. My stepson went to this hospital in the ER. When my stepson went to the hospital in the ER with a hemoglobin of 5, they transfused him and sent him home. They didn't keep him for a 23-hour observation. They didn't do a colonoscopy. They didn't recommend GI. They just transfused him and sent him home. Didn't recheck. So it's like the Tuskegee experiment is full blown. I seen it in Texas. I'm seeing it in Iowa. And again, not every hospital is like it. But I'm seeing it, and I'm seeing it in full force. And when I worked in Texas, and I witnessed Asian people who've taken on the racist antics of, I want to say, white America. Racist white America, not all white America, racist white America. And they hired, through nepotism, they hired mother, father, brother, sister. 22 nurses on a night shift. 1 black American. 1 African. 1 Latino RN, 1 Latino LPN. All the rest were Asian. And when the Asian people didn't want to, and we had 18 Filipinos and 1 Vietnamese. Every night I worked with the Vietnamese nurse. One night, the nurse came yelling and screaming. They didn't want to help with my patient. They didn't want to do anything. So I was coming around by the ice machine, and the Vietnamese nurse says, why can't I work with the other Asian nurses? Because it was 2 different sides to the nurses station. She said, why can't I work with the other Asian nurses? Am I not Asian enough to work with the Asian nurses? Well, the Filipino nurses, at the other end, they had the Filipino tech, the Filipino nurses. They had a whole eating spread at the nurses station. They were sampling food. And they were all just like a village. And they were eating and sleeping. And if one wanted to sleep 6 hours, the Filipino charge nurse went and did his medications. They covered for each other. Hiring through nepotism. Mother, father, sister, brother. This one nurse got some thing up her butt and didn't want to work with me. Then we had a patient who was white but looked black due to liver issues, and they assigned the patient to me. And when the bed alarm went off and I was in there and I was doing the best I could, this heifer came to the door screaming and hollering, turn that bed alarm off, turn that bed alarm off. And she didn't come in and try to help. She didn't try to prevent the patient from falling. In Texas, she was just screaming at the top of her lungs. You would think, honestly, I was in there fighting her husband the way she was screaming. So she was screaming and hollering. She stomped off, had a whole whatever. I did what I was supposed to do as a prudent nurse. And when I finished with the patient, I walked out. I was coming around by the ice machine, and I heard this chick say, why do I got to work with the black nurse? Am I not Asian enough to work with the Asian nurses? So I sent the people an email, my director and my manager. I got a copy of it. And I said, you don't have to work with me. It's 4 days in a week. It's 7 days in a week. I'm scheduled only 3 shifts a week. I said, give me your schedule. I said, baby, you pregnant. And I said, as a nurse, as a grandmother, as a mother, I care more about your health than you do. I said, because I don't want you yelling, screaming, and stomping because you have to work with me. I told her, give me your schedule and let me make my schedule on the days that you off so we don't have to work together. I said, because the remark you made about why do you have to work with me, baby, you don't. I said, just let me know your schedule. And the Latino nurse was in there with us. I don't know if she expected me not to say something about the comment that I heard her say, but I did. Then after I told her about the comment that I heard her say, I sent an email to my managers. And I applaud her because she said, yes, I said it. And why do I have to work with the black nurse? And all the Asians and Filipinos was working down there together. And as always, me and the African. It was me and my day. Me and I forget the Hispanic girl name. The LPN RN. Or me and the Omega, the African. And that's just how it was. I remember once one of my patients needed food. And I told the charge nurse, the patient is, and I was busy. I had a patient came from OR. I couldn't leave. I had to do frequent vitals on. I had a patient that was trying to climb out of bed, was disoriented. I had like another patient with frequent vitals. So I was busy on the step down unit. I just couldn't leave the floor right then. I'm calling the charge nurse who don't have patients. And I said, I need to get this patient a meal. He said, well, you're going to have to do like everybody else. When you get time, you delegate to your tech. He's sitting down there not doing nothing, not assigning no patients. So when the patient's family came to me and the patient said, he need to get food, I said, I've looked in here, I've looked there, and that man worked for the hospital. He went and looked. There's no food back there. I said, I know. So I told the man, I said, go down here as far as you can, go to the left. You ask to speak with the charge nurse Omega. I said, you tell him. Now, mind you, when I was asking for food for the patient, he told me when I get time, go get it myself. And when patients have procedures that are canceled, when patients have procedures that run long, it's your job to advocate for that patient. But in Texas, whether you African or Asian, you don't know the Texas Board of Nursing or the laws that give you your license as a privilege. So the man went down there, and I told him, you go down and talk with Omega. That man went down there. He came back in less than 60 seconds. He was all stressed about his dad not eating. He came back. He said, everything is fine. I'm going to go home now. And I had got to a point, I put a telesitter in the room. I did something else. I got the frequent vitals, and I said, I'm going to go find you something to eat. As I was walking by Omega, before he could see, I was in his line of sight, I heard Omega talking. Omega told the tech, stop what you're doing. Go down there and get lunches. And he's telling this nurse, not MJ, what's her name? I think it was MJ because MJ got fired. He's telling this nurse, he said, what did he tell the nurse? Oh, he told the nurse, that guy just came down here. He and I is from the same village. He said, oh my God, how small it is. He said, I told the tech to stop what she was doing so she could go down and I told her to take a garbage bag and just fill it with boxed lunches. Why is it when you think the patient is American, they don't deserve to eat? This is the bullshit that I had to, again, when this patient's American, they don't deserve to eat until the nurse, who's African American, can go get them something to eat, and then you done made my assignment. Texas got what they call these different laws, and if the patient's too high acuity, you call the charge nurse, and you call safe harbor laws. But when you're a Black American at Memorial Hermann, they want to give you safe harbor assignments. I mean, I would get an assignment that was so heavy, and when I would be working all night, 2 nurses would say, I can't take this patient tonight. It's too hard to be with my other three patients. Somebody else need to have this patient. Now, mind you, the lady who made my assignments, my safe harbor assignments, was Allison and Tracy. Allison was American, but Allison, they didn't like the fact that I was honest. Tracy was just Asian, and she didn't like the fact that I was Black and American. When Tracy made MJ assignment, my assignment, it was another lady. I'll think of her name. What's her name? It was after I told management, I told management, I said, I told management about how I didn't want to work with Black nurses, Black American nurses. So they hired 4 Black American nurses. They thought I was going to file a complaint with the EEOC. After 6 months of not receiving a complaint, they started getting rid of us one by one. They changed the attendance policy, and they said we're going to go back 9 months, we're going to go back 6 months, and we're changing the attendance policy. Well, see, when Allison wanted to go home early, or her husband had surgery, Allison told Evie, I'm going home. And Allison gave her badge to Evie. So when Evie punched out, Allison punched out. Allison got paid for the whole 12 hours. If Evie would go to the time clock with 2 badges and no problem. They had an African at Memorial Hermann Southwest, and he was over the time schedule. So if you got 12 hours and you don't have no PTO, and you were African or Asian, they would pay you for the full 72 hours, even though you didn't have the PTO. It was so corrupt, and everything was fraudulent. Only thing that wasn't fraudulent at the hospital was the doctors. The doctors was on point. They put the orders in, and again, I saw so much corruption. I saw patient abuse. I reported everything. And the Asian people, the Asian staff, they were like, we're not going to work if she's on the clock. They couldn't kick a patient's ass in front of me and I not tell. If you were Black American and you had a patient and the blood pressure was 70/30, heart rate was 160, respirations were 6, the African or the Asian techs would get the vitals, see the patient was clammy and unresponsive, and walk out that bitch like they didn't give a fuck. And when you did your rounds as an African American nurse, you found they deliberately didn't tell. And when I saw them do it to Cerise was like, my patient was this, my patient was that. Then you pulled up the vitals in the computer, patient hypotensive, tachycardic, and barely breathing, and she put all the vitals in there and walked off and didn't notify anybody. Cerise was like, oh, she pissed me off. And the charge nurse who was Asian knew. The African nurse knew. They had an African tech bring a sleeping blanket every day. If it was the African tech had a cousin that worked there, and they said, we're from the same village, we cover for each other. So they didn't take care of the patients. They again, if I at first I was noticed it'd be 10 o'clock and none of everybody else's vitals was done, but everybody else was not American. So if you're at Memorial Hermann Hospital and you had a American nurse, and everything is educational based clinical data, all my facts can be backed up in the system. Everybody else's vitals and blood sugars was done by 8 o'clock. It'd be 11 o'clock and I'd have to go get my stuff, or I'd have to get it myself so I can get my medications on time. They wasn't doing the blood sugars. They wasn't doing the vitals. And I got a whole video where they did it to another Black nurse. Nurse floated down from somewhere, and I recorded a conversation because what was done to me was being done to other Black Americans. If you were assigned an Black American nurse, you didn't get food unless she found time to break away from patient care to go do it, while the person who was sitting at the nurse's station as charge nurse with no patients didn't get that patient no food, and the patient hadn't eaten all day. The discriminatory racist practices. And I sent a text to my manager. I don't regret it. I said, I've only seen shit like this in a Holocaust movie. I don't regret it. Because this is patient care. The people in the hospital is helpless. Helpless. So if you're going to have your Hitler-ass tactics, do it at home. Why the fuck you doing it in a hospital when the patients can't take care of themselves? How you assaulting Jewish American patients and not going to jail, and management covering for you because they want to have staff. Again, if you go back to the time that I worked there and you pull all the surveys, patient surveys, that ain't part of HIPAA. This is patient surveys. They just send them back. The surveys got the same wording in it. When I went to the charge nurse, I said, she assaulted my patient. She grabbed, the patient said, don't put them dirty socks on my feet. Alice has gave me education and teaching. She said, Alice said when I wear the socks, because I had an incision from my ankle to my groin. She said, Alice told me to take the socks off. She said, every time Alice gives me a bed bath, Alice washes my feet and put clean socks on them. And she said, don't put those socks on my feet. The tech grabbed the patient's surgical limb as tight as she could, snatched that patient's leg towards her as hard as she could, deliberately inflicting pain. And she said, it's just for a second. I went over and I stepped between that patient, and I'm old and I'm on blood thinners. I went over and I stepped between that patient, and I stepped between that tech, and I said, you're dismissed. She said, what? I said, you're dismissed. I said, I will take care of this patient myself for the rest of the shift. Patient looked at me. The tech looked at me. I looked at that patient in her eyes, and I said, please leave. I didn't cuss. I had tone. I wasn't disrespectful. I just witnessed an assault. I went to the charge nurse, Omega. I said, Omega. I said, we need to call the house supervisor. We need to file a complaint. I said, she just deliberately hurt the patient. He said, management is aware, and I'm an extension of management. I'm the charge nurse. He said, management would rather have full staff than happy patients. So you gonna look the other way? I'm following nurses. Again, it's all in the system. If you black and you can't talk for yourself, or you're black and you're really sick, all of a sudden you got blood sugars 30. Every time I follow the same nurse, I'm doing everything I can to get this blood sugar up. Glucagon, D50. Why am I following the same nurse every time and the patients are giving too much insulin? Coincidentally? Or is it a fucking, they say a trend here? It's like I can't make this up. It's all data. And when I told Omega about the patient being assaulted, when I told Omega about the patients being cussed out, not giving water, not giving food, threatened, he said, I tell the patients just to put it in their survey that they were handled roughly. So the patients were making the same complaints that this nurse was making. And I was sitting in a staff meeting in December, and the director and the manager is in there, and there's like, we're getting a lot of surveys back, and the surveys have the same terminology, the same words Omega said to me. The survey said they're being handled roughly by the staff. Now you witnessing patient abuse. I'm reporting patient abuse. The patient's reporting patient abuse, and you tell them to put in a survey they was handling roughly, and I'm guaranteeing 100%, I will bet my license and my life, 100% of them complaints that said we was handled roughly was American patients. I will bet my life wasn't one of them handled roughly complaints was from an African patient or from an Asian patient or somebody who, again, if you was born in America, them complaints came from you. I witnessed it. And then I witnessed the staff, the techs at the nurse's station. Yeah, I went in there and I cussed that patient out. I did this, I did that. And they don't want me back in that room. Thank the Lord, I got one less patient. Thank God, I got one less patient. How are you going in there beating the patients up so the patient's scared, don't want you back in the room? And you started with 10 patients and now you got 6, and you happy that the nurse got to do all the work? And management is aware and you have a job? And then one time they called me when a patient, one of the African techs threatened the wrong patient, and that patient asked for me, said they want that tech back in there. So about 3 days later, they said, girl, she could have blew your brains out. You didn't even know she was threatening you. How the hell you threatening me? And I got it on. I recorded the conversation. I hung up, called the police. Police said, we don't got no proof. Police said, we got to record the conversation. I recorded the conversation because the police directed me to, and I called my director home number. Do you know they come for that African? Because 90% of the staff that they hire at that Memorial Hermann Southwest is Asian or African, not American. And when you go there and work, they tell you the Black Americans work at TMC. So these hospitals, Memorial Hermann, it didn't shock me when the people on the CNN got all their news, that the people on the list, that the people Well, how they do it? The people on the list talking about some. Now, if you got hypertension and kidney transplant, that's majority of Black Americans. Go look it up. I don't know very many kidney or renal failure. 90% hypertension is a Black disease. Hypertension damages the kidneys. The heart perfuses the kidneys. The kidneys does all these things. When you have high blood pressure, it damages your kidneys. So and then when your kidneys get damaged and you're at a certain stage of CKD, you have to have a kidney transplant or put on a transplant list. I believe 80%, if not 75 to 80, if not more, the percentage of those people getting a kidney transplant are African American. Now, what are the odds that Memorial Hermann, who very seldom hires American nurses, and then again, and I'm going to tell you another thing. I was talking with Omega, the African nurse. He said his job is guaranteed. He didn't have to worry about the Texas Board of Nursing. If we had a drug, they had, okay, so I said, what can we do on this floor? They said, we cannot titrate this, that, the other. They got to be in ICU. So the doctor wrote an order for us to titrate. I forget what it was. It was a drip. And it was an anti-arrhythmic. I don't know what it was, but we couldn't titrate the drip on the floor. We could run it at so many mics per kilogram per minute, but we could not titrate the drip. Again, if it's Cardizem, we can go up to 15. That was it. Whatever the drip was, we had a limit that we can titrate. So I said, well, when they tried to give me the patient, I said, I can't accept the patient with these orders. And the charge nurse, he was Italian, and again, he was an American. But that charge nurse, Frank, was legitimate. Frank was down to earth. Frank knew what the Board of Texas Nursing said, and Frank abided by it. However, that was just Frank. So Frank was like, we need a different order, or the patient had to go to ICU. Patient came to our floor the next day. They assigned it to Omega. Omega titrating the drip. Now, again, Omega is the type person where he will titrate the drip, but the patient was American. Patient wasn't African. Again, if I look at Omega, if that patient had been African, Omega wouldn't have been titrating that drip. Omega would have been a patient advocate. But that was a white male. So what did he care if he messed up and killed the patient? What are you going to do? Go by the sign on the front of the hospital that says contact the Joint Commission per email. And when you email the Joint Commission, it tells you the Joint Commission don't accept emails. And if you go on the Joint Commission website and try to file a complaint against the hospital ain't even listed on the Joint Commission. It ain't nothing but a fraudulent system. They can kill billions of American patients, or I say millions, get away with it. They can scandalously move the Black Americans down on the list and put somebody Asian or whoever else did a kidney transplant up on the list. But, after I seen Sandra Bland, after I seen Miss Massey, after I seen the soldier, get shot. But I don't know if it was Dr. Ritchie or if it was the other guy, but he was talking to a guy out of California. And the guy out of California said more people, African Americans, more Americans is being killed in the hospitals than the police are killing. And if we're not trying to have transparency in the hospitals, and if a nurse, again, I look at it like nurses are coming up. I just seen a case where a nurse actually killed one patient and they wrote her up. And then 3 more patients died. And so then the district attorney, what made the hospital decide to send it to the district attorney after 3? And then you got the one person who's giving all these people potassium in Texas. They got tired of digging people up. They just said, we can't change it. And then Texas has a law. If somebody dies within 24 hours of being admitted to the hospital, it's an automatic coroner case. You better look into these Americans' deaths. Black Americans are being, and it's not where I'm at now. And the racism that's plaguing our policing in America, the racism is plaguing our healthcare in America. I was working in Mississippi. I was sitting down with a white manager. The manager, the director, the assistant manager, everybody was white. Nurse supervisor, not a nurse, but she was white. I'm sitting down with the managers and directors, and I said, I'm witness this, and this. I said, and all the 90% of the staff was African American. She said, now this assistant manager said to me, because every time I get a heart failure patient, I make sure the bed scale work. I make sure everything works in there. I put the patient in the room. I do the daily weights. And so the staff was like, she going out the way for the white people. She ain't from here. And she just loved the crackers or whatever they was talking about. So I said, these people's crazy. This is a human life. I'm love everybody. I'm trying to get to heaven. I'm not going to get to heaven. What these people who don't know, who talking about Jesus, take the wheel. Try Jesus, don't try me. If you have hate in your heart, that's spiritual murder. So you're a murderer. With your ignorant ass, you're a murderer. You don't got to actually kill anybody to be a murderer. You can hate them and be a murderer spiritually. So you're going to get to heaven thinking that all of a sudden, I'm going to heaven. I go to church every Sunday. But you hating white people for stuff that, for the racist stuff you done seen around you that's crazy. No, you can discriminate against me. You can hate me. You can hurt me. I'm not going to hate you. Because I know that's murder, spiritual murder. But anyway, this lady named Miss D. And I ain't holding back no bars in Mississippi. This lady named Miss D. She's like, go down there, and I bet you that patient white. Every time a white patient come up here, she putting extra stuff in the room, and she doing all this stuff. She just love white people. She ain't from here. They come down there and go back and tell Miss D, the patient black. Oh, lo and behold, Miss D, you just what? So couldn't get rid of me talking about couldn't do that. Then they tried to tell me you need to sit in this one spot. They wanted me to sit in one spot. And I was like, something wrong with these women. They want to delegate like I'm in preschool where I sit. I was like, oh, they up to something. This ain't right. This ain't kosher. I've been in this business too long. So I started like just dodging on their butt. I just ran the whole shift. I could walk out of my patient's room. Miss D have her huddle meeting with her 2 techs. And I got a confused patient. And I walk out of my patient's room. I had the patients 3 nights in a row. Patient ain't never wrapped their gown around their neck. Patient ain't never wrapped their IV around their neck. Only thing the patient do is try to get out the bed. But she can't walk. She thinks she can. So I done had the patient and I done followed the trends. So the Lord, the Holy Spirit tell me, I see the 2 techs coming out. I go in the room at 7. I get there 15 minutes early. I don't even punch in. I just get report. After I get report, it's like 6:55. I punch in. Yep, I did it wrong, but I wanted to just be active all shift. So I get report. I punch in. And I go to this patient. I hang the IV fluids. I see she got a clean gown on. Everything like it's supposed to be. I restart her IV. I come out the patient's room and I go do my rounds on my other patients. And the 2 techs come out the room and they looking at each other, they look at me and they close the door. Why would you close the door on a confused patient when you know the door is supposed to be open where you could see? And I asked them, could I move her close to a nurse station? They said, we're not rearranging these patients. And the policy says if it's high fall risk, move close to a nurse station. I called the doctor and I got, so what happened was they came out the room. Now, I was in there at 7 o'clock. I came out. 7:15, I go in this patient's room. The patient can't move her legs, but she can move her arms to get over close to the edge of the bed. So it takes her about at least 6 hours to scoot to the edge of the bed. So from 7 o'clock when we repositioned her in bed and had her straight and I restarted the IV and I walked out, 7:15, they come out and they close the door. I go into that patient's room because the Holy Spirit told me go check on your patient. Why they closed the door? I go in that room. IV cord wrapped around the lady's neck, the gown wrapped around the lady's neck. That lady turned over 1 or 2 times, she gonna be strangled. I said, what the hell going on here? So I said, again, now Miss D, the charge nurse, and these 2 techs do everything Miss D tell them to do. So I unravel the patient, and I'm like hysterical at this point. And I go and I call the house supervisor. I said, I just came out of the patient's room, and and I said, we need to put a sitter in that room. Well, now the lady white, everybody on the staff from the shift is black. The lady white, she said, the patient white. Miss D said, we don't have a staff for no sitter. I said, what do you mean? The patient got the lady got the IV cord around her neck. The lady got the gown around her neck. She could have strangled herself and died. Now, do I think that those techs wrapped that shit around that lady's neck? Yes, I do. Can I prove it? No, I can't. But again, 15 minutes, you done got your clothes off. Now, you move, but you move slow. This lady didn't have good range of motion of any extremity to wrap a cord and a gown around her neck. Is it possible? Yes. In 15 minutes? No. It took her 6 hours to scoot to the edge of the bed to send the bed alarm off with all of her medical history. So I said, so I'm calling the house supervisor, and I said, I got an order from a sitter from a doctor. I said, I went into the patient's room, because, see, the plan was backfired. They was going to have the patient kill themselves after they wrapped the cord around their neck. This is my hypothesis. They was going to have the patient kill herself, wrap the cord around her neck, and then thinking I wasn't going to do my rounds. And they was going to sit me at the nurse's station in a delegated spot. And then be like, well, this patient died on your watch. Your contract is terminated. Not me. I got God on my side, baby. So I called our supervisor and I say, wait a minute. I said, I need a sitter. And she said, pull one of the techs. The charge nurse intimidated the supervisor and said, we not pulling our tech. We need our techs on the floor. We got a doctor's order. Miss D delegated. So I got my computer on wheels, and I got me a chair on wheels, and I sat next to that patient's room all night. So about 2 days later, I'll get off work, and I speak with the manager. And I'm telling the manager, hey, there's something going on here. I said, why? The next night, a black American needed a sitter. And the nurse was running around real busy. That black patient that needed a sitter, they pulled a tech and had one tech for the whole 30-something patients. They pulled that tech and told that tech, we pulling a tech, you sit with the patient. Now the white nurse who had the cords wrapped around her neck and a gown wrapped around her neck and a noose, we ain't pulling no techs, they can have a sitter. But the black patient who may fall and get out of bed, we gonna pull a sitter for him. I said, this is, again, the racism in reverse. I said, this is the most jacked up mess I've ever seen in my life. So I'm talking with the director or manager, assistant manager, and I got the text. And I said, this makes no sense to me. And she said, Miss D is on her last write-up. She said, Miss D killed a patient. And when she was on her last write-up for killing a patient and said she get one more write-up, she's going to be terminated, Miss D said, I know how to cover my ass. Why is it the police covering their ass and shooting people that they Hitlerish behavior? Then you got black America, whether it's or Asian America or white America, killing people in the hospital, know how to cover their ass. Where is the government agency in all of this? Where is the standards of care and the standards of practice? Because in this whole time, I've been at about 2 hospitals, no 3, that actually, it was Kingwood, ACA, that'd be number 3. 2 would be Moses Cone, Greensboro, North Carolina. And the hospital, it would be 4. 4 would be MUSC Florence. And 1, the best care I've seen, hands down, where the doctors care about the patients. They don't care what race you are, what religion you are. I said they creme de la creme. And that's McLeod Hospital. I don't give it. If you put me, again, the nurses will get a pill, don't understand what or why. But I'm telling you, McLeod, they got to have, if the hospital, if they would do mortality ratings on surgeries and inpatient, McLeod got to be the least one. When I tell you I ain't never seen patient care, patient orders like this, you know, every hospital have their hiccups. But I ain't never seen a place, I've never seen a hospital so professional. I mean, they're so good at what they do. And like I said, I was at Mercy. And Mercy, they treated black people wrong, but Mercy, again, that's just Cedar Rapids. I've been to Unity Point in Waterloo, Iowa, and my EKG looked like a kindergartner drew it. And that nurse had a master's degree, but she put that EKG on my chart. So if I was having a heart attack, like a lot of Waterloo, Iowans patients go up there, the citizens go up there to Unity Point in Waterloo, Iowa, and they have an EKG, and they admit you based on that EKG of your troponins. The cardiologist can't say if you having a STEMI or NSTEMI. They can't say what kind of acute coronary syndrome you're having based on your EKG when it looks like a kindergartner drew it. So, you know, I don't know what it's going to take, because I don't know if it needs, I think it needs to be state legislative, not government legislative. Iowa needs something more than a board of nursing that can dictate and govern health care to citizens. Because JACO ain't going to do it. The hospital's going to give you this blank, contact JACO. Then when I worked at a hospital in Nacogdoches, Texas, they had no working computers except one. So all the nurses scanned the medication. And they got national patient safety guidelines. All the nurses scanned the medication at the nurses station and then walked in and gave it to the patient. I got your medications. They scan the armband on the chart, not on the patient. Scan every patient medication and walk in there with a cup of water, already open, here's your pills. And it violates, and it's like the only time the equipment work at the hospital in Nacogdoches, they said, is when the JACO come and do an audit. If JACO ain't in the building, so imagine. So this is how, and they train nurses. So the nurse told me, she said, we scan the medications at the nurse's station, medication at the nurse station, we go give them to the patient. I said, that's against the National Patient Safety Guidelines. This is, if you don't know what you're doing, why you're doing it, when you're doing it, and how you're supposed to do it, they gonna have you killing people. They gonna train you to kill people. So, they teach you one thing in orientation. You get out to the floor, and they tell you, none of the computers work. So I went around to every computer till I found one to work. Then I got the medication, I scanned the patient, and I scanned each medication. The nurse was my preceptor. She came up to me, and she said, what are you doing? I said, I'm in compliance with the hospital policy and procedure and with the National Patient Safety Guidelines. I'm scanning the patient at the bedside, asking him for his 2 patient identifiers, and I'm scanning each medication and telling the patient what it's for, its side effects, and what to report. She said, you need to do what I tell you to do. I said, ma'am, I can't do what you tell me to do. I'm not going to be responsible for a medication mistake. I said, death is final. A job is temporary. She stormed out that room. Nobody talked to me for the next day. The next day, she was rolling her eyes, wouldn't say nothing to me, and she created a hostile work environment. So I didn't do what she told me to do. Now, mind you, this is the same lady who had a fiance, and she was like, yeah, I was engaged, and my fiance, he went into the garage, and he called me and says, "This is what you caused me to do," and he killed himself. Now I'm thinking to myself, as evil as you are, you sitting there trying to intimidate me. How can you act like how can you try to force me to violate patient rights, violate the Texas Nurse Practice Act, violate national patient safety guidelines to do what you tell me to do? No. It is not happening like that. So I said, well, okay. I told the director, I said, I've worked night shift for this many years, and can I just check out and I'll come back and work night shift tonight? I said, because this is not for me. Don't want a new job. Let me just go to night shift. She said, sure, just go to night shift. So I told the supervisor I was going home and I was going to go to night shift. Came in that night, and everybody already talked about what had happened and how I went and found a while to scan and I wasn't doing what they told me to do, and how was I going to fit in there, and I wasn't a Texan. Oh, they was going on and on. And you wonder why. Again, think about a new nurse coming out of nursing school. And they taught her one thing in the orientation classroom. And when you get to the floor, this is how we do it here. This is how we do it here. Violate Texas Nurse Practice Act, violate patient rights, violate national patient safety guidelines. This is how we do it here. And this is how we do it here is the stupidest, dumbest, most ignorant way of healthcare that can ever be done. This is how we do it here. And so think about it. So I'm sitting there and I'm looking. This is why a nurse can give insulin to the wrong patient who's not even a diabetic. This is how a nurse can kill 3 patients and lose her license and be, again, standing before a court and a judge for involuntary manslaughter when she was trained to do the job that way. And her preceptor, the nurse manager, the director, the hospital. Now, again, if this was YSL, it'd be a RICO case. Everybody in the department, y'all planned it that way, you knew it that way, you trained them that way, you covered for each other. If it was a gang, a black gang, it'd be a RICO. So I'm not understanding how policy can be diverted and ignored. I don't understand how national, state, federal guidelines can be ignored or diverted or just not done deliberately. And everybody from the nursing assistant to the nurse manager to the nurse who's killing the patients or abusing the patients is aware. And there's no RICO. I'm not understanding it. Because somebody has to advocate for the patients. The doctor has a guideline, advocate for the patient. The nurse has a mandatory advocate for the patients. So if this is how we do it here, is not part of. I worked with this nurse. She was 23 years old. She had her master's. She was in a doctorate program. And again, everybody wants to say nurses need to be professionals. We don't need to hire these nurses with an associate degree. They need a master's or a bachelor's. So at 17, they graduated from high school. At 21, they graduated with a bachelor's, if not sooner. By 23, they got their master's. They're in a PhD program. But they got about 2 years of nursing experience. So a doctor ordered a GI cocktail. And I'm working with this nurse. And she said, we don't have time to clarify the order. We just give it as pharmacy sends it up. She says, I've been a nurse for 2 years. I have my master's and I'm in a doctorate nursing program. I said, the doctor ordered a GI cocktail. She said, yes, this is how we do it here. We give the lidocaine. When the Maalox come up, we give the Maalox. And when the simethicone come up, we give the simethicone. I said, ma'am, do you understand the mechanism of action for the lidocaine? It's to numb the throat. I said, why would you numb the throat and then give the patient something to drink? Do you realize that there's a time limit when you, I said, let's back up. I said, the doctor ordered a GI cocktail, not lidocaine, 30 minutes later Mylanta, 30 minutes later simethicone. The doctor ordered a GI cocktail. The nurse said, this is how we do it here. I said, let me break it down to this lady. I said, man, when you go to a bar and you order your cocktail, your drink, whether it's Sex on the Beach or Long Island iced tea, whatever your cocktail is, do they bring your cocktail to you in 3 parts, or do they bring it to you in 1 glass? And she got this dumbfounded look on her face like, oh. And then she started looking at the color of my skin and got attitude. And I said, lidocaine. Then I said, you know that every time the epiglottis covers, it protects your airway. I said, so when you swallow, your epiglottis covers your airway and fluid goes into the stomach. I said, if you paralyze or relax the epiglottis, fluid's going to go into the lungs and cause aspiration. I said, I'm not trying to harm the patient and cause aspiration pneumonia. So there's a limit of time. When you give lidocaine or you numb a patient's throat, you have to wait at least 1 to 2 hours. I said, I can check with the pharmacist and find out the length of time. I said, but I'm not going to give a person lidocaine 30 minutes later, Mylanta, and 30 minutes later, simethicone. I said, because they're going to aspirate, and they're going to have aspiration pneumonia because of me not knowing what I'm doing, why I'm doing, or how I'm supposed to do it, or the mechanism of action of each drug. And she said, I don't have time for this. So I called a doctor. He said, oh, no. I ordered that as a GI cocktail. He said, I meant to order it as this. He said, could you please fix that for me? I said, yes, sir. Then I called the pharmacy. Told the pharmacy what the doctor ordered. I fixed the order. And then they sent me up the GI cocktail, and I went and gave it to the patient, and I educated the patient. You have to wait at least 60 to 90 minutes after you do your GI cocktail, before you drink or eat anything because of risk aspiration. And then I explained the epiglottis covers the airway when you swallow, so the fluid goes into the stomach, and how air is only supposed to go into the lungs. And if you cough after you drink or your voice changes, that could indicate that you're aspirating and you need to wait a little bit longer, but contact your nurse because she could check your swallowing with a bedside swallowing test. And when it all happened, it came to into fruition. The next day, I went to work, and I was scheduled to work with this lady, and she was like, I'm not working with her. She's been a nurse longer than I've been born. She can work with somebody else. She was upset because I didn't do what she told me to do, how she told me to do it, because this is how we do it here. Like, I'm supposed to fit in, have a job just so I can eat and make my car payment and rent payment just to fit in here. I'm supposed, let me just go ahead and just kill 5 or 6 people and then pretend, oh, we don't know how they aspirated. And what governing body is going to go in and look like this hospital has had a 90% increase in aspiration? That same hospital, Covenant Hospital, Waterloo, Iowa, they had a patient that had, patient had a very contagious C. diff. And I walked into the patient's room, and there was no dirty utility or dirty basket for everybody just taking off the gown and got a pile they got a pile in the room. And stool, C. diff stool, all over the side rails, C. diff stool, all over the overbed table, all over the floor. And I'm looking like, how in the heck is this patient supposed to get better? And we treating him. He gonna keep cross-contaminating. So I gave the patient wipes for hand care. I got the bleach wipes. I wiped down the side rails. I gave him a bed bath. I changed the sheet, the gown, the beds. I wiped the floor. I cleaned the overbed table. I cleaned the phone. I cleaned the call light. And I said, sir, you cannot have stool everywhere. They're treating you to get rid of this disease. So you have to practice hand hygiene, and you have to, stool that's contagious can't be everywhere, or you're going to keep reinfecting yourself with the bacteria. And again, so when I came out, and then I got a linen basket in the room, and I took all the linen and put in there, and then I did what I could, put bleach wipes on each one of my shoes, and just went over the floor best I could. And then I cleaned it all up and walked out, and I came out, and this lady, she worked for the NAACP or some whatever, some division in Waterloo, not NAACP, some commission in Waterloo deal with discrimination, civil rights, whatever. She said, I told you you're supposed to take a report on the patient. I said, did you see the travesty in that room? I'm supposed to just walk in and get this man, he got feces from head to toe, side rails, over bed table, call light, cell phone, personal phone. I'm supposed to walk in, give you your pills, and walk out so I can come out here and take a report? Now, I have my doctorate in nursing. Well, how did you walk out that room with it looking like that? So, so then I was supposed to give beta pace, and I said, the patient get beta pace. I said, I know there's a standard QTC for women and standard QTC for men. I said, but is a standard for the beta pace across the board, like in every for all cardiology? Because you know the when you're measuring and when you're interpreting telemetry strips, and you're interpreting and you're measuring PRI, QRS, QTC, QT, ST segment. When you're measuring these things out, you know, certain hospitals will say a PR interval should be this to this. Certain will go to 0.2, 0.20, certain go to 0.16. So every hospital, in each hospital, even in the same state, it varies about the measurements. So I asked her, I said, the QTC is not on the MAR on what I'm looking for. So before I give this, and 2 hours after I give this medication, I said, what is the QTC? Because it says the QTC is supposed to be whatever, and then there's a line where somebody's supposed to fill it in, and they didn't. And she said, there's no variable in the QTC between men and women. And I said, yes, it is. I pulled it up on my phone. She said, well, in this hospital, this is what I asked her. In this hospital, because the doctor didn't fill it in, I'm in training, what's the measurement? And she said, in this hospital, it's greater than, I think, 0.500. That's standard. I said, all right, thank you. But the next day, she wasn't orienting me anymore. And